Hi, and welcome back for another rotation recap video. This video is going to be all about my surgery clerkship and how you can prepare for this third-year rotation. I'm going to go through different study resources, the typical day of a med student, and what the role of a medical student is like, and also share an embarrassing experience that happened to me in the operating room so that you can avoid this for your future rotations. I try to post new videos every Monday, so subscribe to my channel, The Curious White Coat, so that you can keep up with the latest videos. Surgery is one of those required rotations that all medical students have to take in order to graduate. The timing of it can vary. At my institution, it's usually 8 weeks, but my clerkship experience was a little different because I started in the fall of 2020. So there were a lot of delays because of the pandemic, and we ended up having our surgery rotation go for about 6 weeks long. It was shortened just by 2 weeks. So for us, we're able to choose different electives that we would want to go on. And my school has a pretty good variety of different electives. I think that comes with being in a big city and having access to a lot of different health services. So some of the electives that we had were transplant surgery, cardiothoracic surgery, there was surgical oncology, trauma, neurosurgery, and a whole lot more that I'm probably forgetting. So I actually chose to do 1 week in a trauma surgery elective and 1 week in a neurosurgery elective, and they were pretty cool. Let's start with a typical day for this rotation. I am one of those people who likes to get as much sleep as I possibly can. And I determined that this surgery rotation was not gonna take that away from me. So I was able to try to push my alarm clock as late as possible. And I did this by preparing everything that I would need ahead of time. So I would meal prep for the week, and I would also wash and iron all of my scrubs. Yes, I iron them because I don't like to be wrinkled, and I'd have them hanging for me in a certain part of the closet so I could just grab and go in the morning. So I would wake up around 5 o'clock, sometimes 5:20, 5:30, and I would take a shower, eat breakfast, get dressed, and then be out the door as fast as I could. So I would arrive to the hospital around 6:30, which is when the residents wanted us to be there so that they could give us our list of patients. We typically get anywhere between like 3 to 5 patients each, and we would pre-round on them. So pre-rounding is when you go by yourself as the medical student before other people have, and you'll check on your patients that are on your list. When you do this, you want to look through the notes to see what happened overnight, what consults were called in, what their recommendations were. You'll also want to speak to the nurse and get a lot of information from them, as well as talking to the patient themselves. Don't be afraid to wake anyone up. Unfortunately, the hospital is not a spa, so we do have to wake people up and make sure that they're feeling okay and that nothing bad is happening. And also, when you think about it, like, you want to make sure that your patients are able to wake up and that they can be easily roused. Otherwise, something could be wrong. So you always want to make sure you go in, you wake the patient up, and you talk to them. If they have different bandages or anything on, move it. You know, you're going to put it back on when you round for surgery. So check on the wound, see if there's any signs of surgical post-op infections or anything like that. You'll also find that while you are the med student and you need to know a lot of details about your patients and take ownership of them, you're not going to necessarily talk about all of those details when you present. So there are going to be different styles for every specialty that you rotate with, and you might find in surgery that it's more oriented towards post-operative care, to see, like, are they having bowel movements? Are they vomiting? Are they having fevers? Are they having trouble breathing? Anything that's related to the surgical site, you want to make sure that you're well informed about, which is probably different than internal medicine, where you're going to be focused on other things about that patient's care. So after we pre-round, we would meet around like 7:30 around 7:30 with the residents. We would present really quick if there was anything pertinent going on with our patients, and then we would round with the attending, any nurses or other people that were part of the care team. But typically for us, it was just the attending, the residents, and the medical students. There were about 5 med students that were with me at this site. We were at a hospital and also at an ambulatory center, so we'd see surgeries from there, and we would actually rotate surgeries. Since we were in the middle of the pandemic, elective surgeries hadn't really picked back up yet, and we would have to alternate different surgeries so that we could all see something in a day. Around 8 o'clock is when surgeries typically started. So you could either finish rounding with the team, or you could go to the case that you're supposed to scrub in for. For the rest of the morning, you're pretty much seeing cases. And then at some point, you'll get your lunch, you'll study if you have time. There might be didactics going on. And I feel like most of the time, if you're at a clinical site that has residents, you will most likely join them for their didactics, which are hosted in the morning. And then in the afternoon, you'll do a lot of the things that you kind of did in the morning. So if surgeries are running over until that time, you'll go see them. If you're assigned to surgeries, we would go see them. But you would also check in on your patients and see like how they're doing. Maybe someone who just had surgery yesterday, or someone who had surgery first thing in the morning and now they've been out for a couple of hours. You check on them and see how they're doing. We typically would get out around, well, I shouldn't say typically because it could vary a lot. I got out anywhere between like 4 in the afternoon, 3 or 4 o'clock, to 9 o'clock at night was the latest time I left the hospital. But I will say I planned to be out around 7 o'clock. Once I got home, I would eat dinner, I'd take a shower. Taking a shower was the first thing I'd do. I would take off my shoes and then go and just take off all of, the dirty, germy hospital clothes, and then I'd take a shower right away, and then I would eat dinner, probably like watch Netflix or something that I could do quickly, just to kind of like have some downtime for my brain, and then I would try to study. During the week, the most studying that I really could do was to either read a quick chapter or do a couple of UWorld questions, like maybe 20 question blocks, nothing long. The majority of my studying, though, I'd have to say, was on the weekends. So yeah, a typical day would be anywhere between waking up at 5 o'clock and then, for me, going to bed at 10 o'clock, because like I said, I was trying to get my best sleep possible in this rotation. There are going to be certain procedures that you notice come up again and again in general surgery. I guess they're kind of like bread and butter cases. So there were a lot of cholecystectomies, which is when you remove the gallbladder. People say that the appendectomies are very popular. I didn't see a lot of them actually, but it is a very common procedure in general surgery. There was also a lot of hernia repairs, especially inguinal hernias. And breast biopsies were quite common, which surprised me a little bit. But when you think about it, it makes a ton of sense, because you have some patient who, prior to the surgical experience, either discovered a lump on their own, or the doctor did, or maybe they had a mammogram and a mass was found, and now they're going into surgery to have that mass removed, and then it's going to be sent off to the pathology lab to determine the status. So those are some of the common procedures. And when you get in, make sure that you know some basics of certain things. Like, know the basics of wound care, know whether to pack like wet to dry, the types of things you might use, different types of gauze. When someone's asking for a 4x4, know like what that is when you're walking into the supply room and getting stuff. And if you don't know, just ask. That's so much better than walking around aimlessly through the supply closet not knowing what you're looking for. And also make sure that you know the tools that are used in surgery. I did not know them, That like totally slipped my mind. I don't know why I didn't think to look that up beforehand. But thankfully there was a surgeon who actually created this presentation for all of the medical students and the residents, and he gave it to everyone, and it had a list of all the different surgical tools and their names, and that was very helpful. So like at some point I did know the different names of the tools. Now I've forgotten them, and they're just like the claw shaped thingy and the big pair of scissors and the big pair of tweezer looking thing. Like that's what they are in my head now. But at the time I did know them thanks to that surgeon. Also, something that you may not think about, know how to scrub. This is that fancy, hand washing technique and all that stuff that you do to make sure that you're sterile. Not every place you go to is going to show you how to scrub. Luckily, my school had coordinated with our sites to show us how to do that in an orientation, but that may not be the norm everywhere you go. So there are different videos that you can look up on YouTube. I think Johns Hopkins has a video on how to scrub, which I had actually looked at that beforehand, just so I would come in with some sort of knowledge, on how to wash my hands. So make sure that you look at that, kind of mark through it. You know how like dancers mark through their steps, like practice doing that so that when it comes down to it, you can really focus on making sure you're not touching anything, because if you do touch something, you have to wash your hands all over again. It's just a safety, precautions. No one wants germy hands inside of them when they're having surgery done. So with all of those things in mind, let's talk about the things that you need to use for study resources. I'll start with my favorite study resource, which was actually Dave Virgilio's. Every part of that book is incredibly useful for the entire surgery exam. Everyone says use Dave Virgilio's and Dr. Pastanas, and I completely agree. But Dave Virgilio's trauma section was like the number one thing I felt like for the shelf exam. Things that I read in there were almost exactly on the test. So I think that was a very useful book for preparing for your studying. Pre-test and case files, I felt like those were maybe lower yield than the other books. They have good case presentations, and I feel like that can help you prepare. But it didn't really get to the meat of things that I felt like the other books did. And pre-test, I think doing practice questions is great. But those questions weren't as good as UWorld as far as how much they replicated, or I guess imitated, the actual shelf exam. So of course, UWorld is like always the gold standard for every exam that you do with the USMLE, NBME, all that stuff. So I would definitely recommend using UWorld. And then just for fun, I read the Greenberg's Neurosurgical Atlas. I think that's what it's called. I can't remember now. But because I had this elective in neurosurgery, it was actually quite relevant. It talked about different anatomical landmarks and everything in the head that correspond to parts of the brain. And that was just so cool to me. And I heard that it's almost called like the neurosurgery Bible or something like that. I guess people say. So I definitely would recommend, if you are interested in neurosurgery, give it a read. You might read it at some point, and then make sure that you know your anatomy when you're studying. So Netters has all these different flashcards and pictures drawn out of all the different anatomy, and that is so relevant when you're in your surgery rotation, because especially for those pimping questions, because you might have someone ask you like, oh, what's that blood vessel? What's this landmark? So know your blood vessels, know your nerves in relation to all of these different structures. And the abdomen can get kind of confusing a little bit. So try to find ways to block it off maybe in sections and know like, okay, celiac has these branches, the SMA has these branches, IMA has those. And don't just know arteries, but also know veins and things like that. And maybe even lymph nodes might be relevant, although I don't really remember getting that many questions on that, on lymph nodes, more so about about blood vessels in general, and then nerves. Now, the shelf exam itself was very trauma heavy, and I mean very trauma surgery oriented. A ton of questions were based off of that. They were talking about shock and gunshot wounds. Like, for example, you might have a question that says, 20-year-old female comes in with a gunshot wound, and now she can't breathe, and her blood pressure is very low, like 80 over 60, and her heart is beating fast, and all of this stuff. And they may or may not tell you where she was shot, but then you have to determine what's going on. Why is she having these changes to her vital signs? And maybe they'll be kind enough and they'll tell you, on exam you were listening and you don't hear any breath sounds on the left side, but that's very rare that they'll be that kind to you. And you have to say to yourself, okay, gunshot wound, what's a common complication of that? And you remember, okay, pneumothorax. And in this case, it would be a tension pneumothorax, because this increased intrathoracic pressure is now keeping blood flow from returning to the heart as efficiently, and then you get that decreased blood pressure. So you have to kind of build off of things, and a lot of your questions will be oriented around that sort of format. I also just want to let y'all know, in case you didn't know this already, that the surgery shelf exam is not going to have what you might typically think of as surgery questions. Like, they don't ask about approaches and techniques and surgical tools, not any of that, because that's something that you learn more so in your formal training as a resident. So at that graduate medical education level, that's when you're becoming a surgeon. Medical school, doesn't focus on that part, so your exam is not going to test you on that either. I will say that the exam was kind of more like my internal medicine shelf. So there was definitely an advantage to taking IM before I took surgery. And it was almost, in a way, had a good chunk of IM on there. So it was like IM plus trauma. And I'd say like IM plus trauma, and a whole lot more things on wound care and post-operative fevers. That would probably sum up the shelf exam that I had. There might be some variation, of course, as you take your exam in your years. So just be prepared for that. And I'll also say that the emphasis of things, you can get different content outlines from the NBME. And I did see ahead of time from that outline that there was going to be a lot of there'd be a lot of GI and cardiothoracic type topics, cardiovascular topics. So I will say that was very true in the shelf exam. So make sure that you know these things. And then as far as other organ systems, if they had anything endocrine, it might be like a case of an adrenal gland tumor or adrenal shock or something like that, like Addison's disease. And for repro, I would say relevant topics in there would be torsion, either of your ovaries or your testes, and then ectopic pregnancies. So GI, cardiothoracic, and then high yield points in the different organ systems would probably make up most of the exam. Okay, so that video started to get a little long, but what can I say? I have a lot of words. So you can actually check out part 2, which is a continuation of this video right here. So go ahead and click, and I'll see you in the next one.